for improving patient experience? I'm sure there's a ton of different areas to look at. Just something that you've recently seen comes to your mind, maybe that it's not popular at practices yet. That would be
Mm,
interesting for me to hear about. And for the audience. I mean, for the audience as well.
yeah. I hear a lot of complaints about wait times. I'm not quite sure what to do about that necessarily, other than some of the things that we've talked about already. But eh, I can share one example of a client of ours who really helped their patients see progress in a visual way. And this gets back to what I was talking about before in making, and I'll tie in a little bit of marketing too, but what I was attempting to share before is that we have some clients who um, might use a video testimonial as part of their marketing process. So you had mentioned, hey, what's our number one tip, and how do we make sure that our uh, our practices are bringing in clients effectively and patients effectively. And reviews have always been very important on the local SEO side. And where I think, back to our patients here, this should all come together, is for these patients who hadn't really visualized how the therapy, in this case, was helping them. We had helped the in-house team at the clinic develop a testimonial generation system. So essentially just a baseline video recorded at first, and then a 30-day video recorded as a follow-up for someone who has difficulty with movement to review and see their own progress. That actually became part of the product, the therapy product that's being delivered to that patient. And when they complete their first therapy session with the product, that testimonial is recorded. And then for our marketing team, that's something that we can definitely leverage across referral networks, building, the brand value. And for some of our private practices that have access to this device, it's quickly shared in the care advocacy communities. So think, and the example I'm thinking of here, we have a client in the epilepsy space who supports many different epilepsy groups, and those have strong referral networks within them, particularly locally. So if someone knows about a new innovation at a new clinic, it pulls folks in, and that really does increase the patient experience when someone can see progress.
That's very interesting because I'm thinking about these videos that you mentioned, right? That really serves like a twofold purpose. On the one hand, it helps the patient realize their own progress. On the other, for the clinic, for the practice, it's great social proof that they can then use outside to try and help more people and get more patients. I want to hear more about that. Somebody listening to this might be thinking, hey, that's a great idea. I would love to implement something like that. Can you talk a little bit about like getting into the nitty-gritty? How did you operationalize it? Is there a waiver that the patient signs? Is this
Mhm.
done just as part of one of the sessions? If you can give more detail on that, that would be fascinating.
So it depends on who we're talking about here. So let's use the example of a private practice, and let's pretend we're that private practice. So I've seen examples of newsletters sharing patient progress and social media posts, and oftentimes the post itself is initially de-identified, right? The person's face isn't in the video to start with. It's a very hyper-focused to the care area uh, video of their progress. And that is probably the first step that I would consider. We don't want to be revealing someone's identity or exposing ourselves if we don't need to. Obviously, there are always concerns around patient privacy, and um, each of in the cases that I've seen this where practices are implementing it themselves, they don't have a regulatory person in-house like our clients on the device side do. They are certainly just using DocuSign operationally to work with their patients on, a media release waiver or something like that. And they've operationalized it a little bit, but it's being shared in, newsletters and social media and their releases, probably compared to, say, a media release that we work on at Cicada, a little bit more benign. I don't think it's often being used for advertising or anything like that. So